Good evening, everyone. Thanks for joining us. I think we'll go ahead and get started with our presentation. Welcome to the My Horse University and the Extension Horse Quest live webcast titled Respiratory Disease Diagnosis, Treatment, and Prevention. This webcast is part of a horse health series which will include 3 more webcasts on important health topics. Our presenter tonight is Dr. Hal Schott from Michigan State University. Dr. Schott received his DVM degree in 1984 from the Ohio State University College of Veterinary Medicine. He started his career with 3 years in private equine practice in Southern California and subsequently pursued advanced training by completing a residency in equine internal medicine and a PhD in equine exercise physiology at Washington State University. Since 1995, Dr. Schott has been an equine medicine clinician at Michigan State University with strong clinical interest in urinary tract disorders, respiratory disease, and endocrinological disorders. In addition, he continues to pursue a research interest of fluid and electrolyte balance and endurance horses. Please note that you are able to ask questions during the presentation via the text chat at the bottom of your screen, and that the presentation today will be recorded and uploaded to our website if you want to review it at a later date. And at this time, I would like to turn the presentation over to Dr. Schott.
Well, thank you, Amanda, and welcome everyone. Tonight we're going to talk about respiratory diseases in the horse, and obviously it's quite a large topic to cover in 45 minutes or so, so we're going to do a bit of an overview. We're going to talk about infectious respiratory diseases, and so infections in horses can be caused by viruses, so there's viral diseases, as well as by bacteria. Probably the 2 most common viruses that will lead to in respiratory disease in horses are the herpes virus, equine herpes virus 1 and 4, we'll talk more about in just a couple of minutes, and then also the equine influenza virus. This picture here is actually an electron micrographic image of equine herpes virus 1 inside an envelope, and here's the nuclear material inside it. Quite small, obviously. In terms of bacterial diseases, obviously many of you may have heard of the disease called strangles, and strangles is caused by an organism called Streptococcus equi, so it's related to the Streptococcus that can cause strep throat in people, and here actually is a chain of strep bacteria that you can see in this image down here. So they end up making long chains of cocci bacteria, and they have unique properties to be able to adhere well to the lining cells of the upper airway and then also some other areas in the body. We'll also talk briefly about Rhodococcus equi. That's another bacteria that is a cause of pneumonia in foals. We don't see much disease in adult horses with that, but foals and weanlings can get severe and actually life-threatening pneumonia with that organism. And then I'll also talk briefly about a adult onset pneumonia, or that we call shipping fever, because long distance transport is an important risk factor for developing pneumonia, and it's largely due to aspiration of normal bacterial populations that are in the back of the throat and the oral cavity, and with the stress of long distance transport and the inability to lower the head and clear out respiratory secretions, the lungs can be overwhelmed and a serious pneumonia can develop. We also can have respiratory diseases that are non-infectious in origin, and many of you may have heard of the condition heaves. Well, the veterinary term for that now is recurrent airway obstruction, and but still known commonly as heaves. And this is more of an environmental disease with some allergic basis. Certainly in Michigan in the wintertime, we don't see this disease as commonly in horses that are outside all the time, unless they're fed round bales, as can be seen here. These 2 ponies that are quite content eating right in the middle of the round bale. So even though they're outside, in their breathing zone is a lot of hay dust and a lot of other particulate matter that can be very irritating to the airway. So we know that round bale feeding is a risk to make heaves become more clinical, see the clinical signs of it in horses that are fed outside in the wintertime. We also can have, and so the heaves can actually cause evidence of respiratory disease, both a cough as well as an increased respiratory effort, just at rest in horses. Probably more commonly we recognize respiratory diseases that are non-infectious and during exercise, and so we can have upper airway obstruction that often results in an airway noise. One of the common ones is called roaring in horses. We also can have lower airway problems, and you may have heard of the term bleeders in racehorses, and we can see here in this picture in the nostril, we see a small amount of blood accumulating and wanting to drain out of the nostril after a racing exercise. And that's also known as exercise-induced pulmonary hemorrhage, or EIPH. We also know that horses that are kept in stable environments or barn environments can have some airway inflammation just by inhaling all the non-specific dusts and odors and ammonia that are in the barns. And this inflammation in younger horses or athletic horses is not quite the same as heaves, but it's an environmental irritation and inflammation we call IAD for inflammatory airway disease. And this is an endoscopic images where we're looking in the windpipe or the trachea about halfway down the neck. So the scope is passed up the nose, through the voice box, and into the trachea, and we see progressively increasing amounts of mucus in the airway, and that's characteristic of the inflammatory airway disease. And not surprisingly, if this mucus accumulates, it's going to tickle the base of the throat and try to have or stimulate horses to cough to try to clear this mucus out. So the clinical sign with this inflammatory airway disease is often a couple of coughs at the beginning of exercise. The material is cleared out, and then the horses can go on and exercise fairly effectively. Okay, we're going to talk a little bit more specifically about some of the infectious diseases now. And so the first one is the viral respiratory diseases caused by equine herpes virus. Another term for this is the rhinopneumonitis virus, or you can hear of it, rhino. There is also a rhinovirus, which is also can cause mild upper airway disease, and it's not very common that we look for it, and there's no vaccination for it. With the equine herpes virus, we do recognize that to cause a more significant respiratory disease. There's a number of strains of the equine herpes virus, up to 5 in horses and 6, 7, and 8 if we talk about donkeys and mules. But the two main ones we're concerned about are EHV1, equine herpes virus 1, and EHV4. Both of these cause clinical signs of respiratory disease, but the respiratory disease is most common in young horses and foals and yearlings and 2-year-olds, and might lead to a condition in the fall where we see a chronic snotty nose in a foal or the foal snots. Oftentimes they actually first get exposed to this virus from the dam. So that's why over here we say, "Thanks, Mom, for giving me this virus." We're probably more concerned about other diseases that can be caused by equine herpes virus, specifically equine herpes virus 1. Because in addition to respiratory disease, it can cause abortion in pregnant mares, as well as we see sporadic outbreaks of moderate to severe neurologic disease in horses affected with equine herpes virus. Now, one thing about the herpes viruses is they're relatively common in horses. Again, they're typically young horse diseases that are acquired, much like the daycare scenario where kids get frequent colds and things, so in the first couple years of life. And by the time a foal reaches 5 years of age, probably 60% or more of adult horses now have had this equine herpes virus 1. Equine herpes virus 4 also causes respiratory disease, and it's even more common. By the time they reach about 5 years of age, probably about 90% of adult horses have been infected. Now, what's interesting about the herpes viruses is herpes is a latent, can become latent in the body. And so we have a saying that herpes is forever. So once they get infected with EHV1 or EHV4, they do not completely clear the virus. It tends to hide out in lymphatic tissue, and it can actually recrudesce or redevelop and start spreading through the bloodstream. What's interesting is after the initial infection with either of these viruses, it can cause a mild febrile respiratory disease. So the horses have fevers of anywhere from 102 up to 105 or so for a day or two, and they're a little bit off feed, and they may then subsequently develop a little nasal discharge after a couple of days and a mild cough. Well, once they've had that clinical syndrome, if they recrudesce either EHV1 or EHV4, or they get exposed to another horse that's shedding EHV1 EHV1 or EHV4, but they've already had the clinical disease, they really won't show any clinical signs on subsequent infections. So what that means is happily looking normal horses that are eating well sometimes can be shedding this virus and causing disease in the naive horses. And that's what happens as mom passes it on to the foals. She doesn't have any signs of respiratory disease but intermittently sheds these viruses, and that's one of the primary sources for the foals. Now, clearly, the most important disease to prevent is not so much concern about the mild respiratory disease in young horses, but we want to prevent abortion in pregnant mares because that means loss of life, and we'd love to be able to prevent neurologic disease. Currently, the vaccines that we use against equine herpes virus 1 and 4, typically, or predominantly equine herpes virus 1, I should say, is that to try to vaccinate pregnant mares every 2 months starting at 5 months of pregnancy, so 5, 7, and 9 months of pregnancy to try to prevent an abortion outbreak. Now, I talk with the students every couple of weeks about this vaccination, and this vaccination is really not all that terrific because if we had a great vaccine, we'd only have to give it once during the pregnancy. We have to give it every 2 months, and the idea here is to try to keep the antibody level high in the blood. So antibodies are proteins that will neutralize the virus if it starts to circulate. And the abortion can develop because a mare has a latent EHV1 infection, and for some reason at some point in her pregnancy that may recrudesce or come back out again, and then the virus proliferates and travels through the bloodstream, and it can travel to the uterus and into the placenta and cause the foal to die and leading to an abortion. So we give the vaccine very frequently to try to minimize the chances that the virus circulating in the blood will reach the uterus and the placenta. So these produce neutralizing antibodies to try it again to neutralize or counteract the virus. And really, what the vaccination is most intended to do is to prevent what's called an abortion storm. And that's where in a group of mares that are pregnant, we may have abortion rates of 50 to 75% after the initial abortion. So unfortunately, in well-vaccinated mares, we can still have an occasional EHV1 abortion. But we should be able to prevent the abortion storm or large losses of foals by vaccination. Now, some of you may be wondering what's the difference and why doesn't EHV4 also cause the abortion and neurologic disease? And that's because these viruses, although similar, this EHV1 tends to multiply in the bloodstream at a much greater rate, whereas the EHV4 is largely retained in the lung tissue, and levels of what we call viremia or virus particle in the blood are relatively small compared to a much higher viremia with EHV1, and that's why it can spread again to the uterus and placenta leading to abortion, or into the small blood vessels in the spinal tissue and lead to neurologic disease. Okay, next we have equine influenza. Now, equine influenza virus is basically caused by two strains, A-equi1 and A-equi2, and they actually have some substrains within them. And everybody's familiar with the talk about the swine flu this time over the last year, and what we tend to have with the influenza viruses is they generally stay within a species. They're species specific. Occasionally they hop over or recombine with flu strains in other species, and that can lead to a more pathogenic or a more disease-causing virus strain, and that was the concern with the swine flu. The horse flu typically stays within the horse, although in the last decade there was a little bit of a leak of the horse flu actually into dogs. Dogs got infected with it as well, and these were largely greyhounds at the racetrack. So in general, though, it's a species-specific type of infection. Now, we think that one of these strains is largely sort of waned out over the years, and now we have substrains where they're referred to as the Americas strain and the Eurasian strain. So Europe and Asia tending to have a group of viruses within the strain in the Americas. So the viruses are a little bit different in the different populations. So the horses in America might be more susceptible if one of the Eurasian strains gets introduced, and vice versa if one of the American strains get introduced to Europe. Those European horses could be more susceptible. The flu virus is sort of quite interesting. This again is a scanning electron micrograph here of the flu virus, and you can see these projections on the outside of it, and those are little spikes that allow it to attach. Those are called the hemagglutinin antigens, and those tend to allow it to attach to the respiratory lining cells, or what we call the mucosa. Now, different than the equine herpes virus, this virus does stay contained within the respiratory tract, does not get into the blood, and does not cause viremia and disease in other parts of the body. But unlike herpes virus, this is a disease that horses can get over and over again, just like people can get over and over again, and that's why it's recommended that we get flu vaccinations every year. We do need to keep flu vaccinations going consistently for horses. So this disease can affect all ages of horses, and repeat infections are possible. Some of you that follow the horse news may realize that over the last 3 or 4 years, there was a significant outbreak of equine influenza in Australia. The story seems to go that this influenza virus was brought in by a stallion, a thoroughbred stallion, or more than one, that were imported from Japan to go to the southern hemisphere to continue breeding during the southern breeding season. Despite being in an appropriate quarantine facility and for an appropriate period of time, the virus still was able to get through on these horses, and it led to a large outbreak of influenza in Australia. Up to that time, Australia had been free of influenza from horses, and so the horses were quite naive, and the outbreak could spread quite rapidly. Although this map here is quite small, it is of the southeastern coast of Australia, in the area called New South Wales, and up into Queensland. And due to some very good public health policies and rapid action by veterinarians, closing large facilities, as you can see this sign here in this facility, they were able to contain this outbreak so it did not spread across the entire continent. But it did shut down racing and a number of horse show competitions and other types of equine events for several months in the fall in Australia. So again, this one can cause outbreaks at different times. The vaccination for equine influenza, we'll talk about here more in a minute. But let's just talk about the clinical signs of a viral respiratory disease in general. I talked about them a little bit already. These diseases can have what we call high morbidity. In other words, in the group of horses, maybe 30 to 50% of the exposed horses can get some of the disease, and this can be mild to more severe. Mortality or death due to the viral infection, however, is quite low. So it's uncommon for horses to die of influenza, just like it's uncommon for people to die from the swine flu. However, certain risk groups like pregnant women have died from the swine flu, and the chances of a horse dying from the flu are less than 5%. Probably closer to 1 or 2%. So out of 100 horses that might be infected, one might get sick enough to potentially die. So the typical disease course is that they're sick for 3 to 7 days, and the signs are a fever and a mild decrease in appetite, depending on how severely infected they are. Recovery typically occurs over 1 to 3 weeks, and that can occur without any form of treatment. This is a viral disease, so antibiotics typically are not that useful. However, about 20 to 30% of these horses can develop what we call a secondary bacterial pneumonia, and that is where the normal organisms in the upper respiratory tract and in the back of the throat will then go down into the lungs due to the already damaged tissue. So it's called an opportunistic infection. And in that situation, the most common organism is Streptococcus zooepidemicus, related to the strangles organisms but different. And the treatment of choice for the streptococcal infections is the antibiotic penicillin. If we want to diagnose these viral respiratory diseases, we can't do it by clinical signs. We can't look at a horse and say it likely has herpes rather than it likely has influenza. The only exception to that is a group of older horses, since the herpes virus tends to cause disease more in young horses. If we get an outbreak in a group of older horses, such as at a horse show or after returning from a horse show, we would be more suspicious of influenza. But the best way to diagnose these disorders, is just take a swab or have your veterinarian take a nasal swab, and then that can be sent to the laboratory, and within about 3 days it can be tested for a variety of viruses and hopefully come up with which one is causing the disease. Now, vaccinations to prevent respiratory disease, I said again, the respiratory disease with herpes is sort of like a childhood disease, may not necessarily be all that bad, but we want to prevent abortions and we want to try to prevent neurologic disease. Unfortunately, currently available vaccines are not effective against preventing neurologic disease. There is a lot of work trying to make a vaccine that will do that, but nothing is available yet. We can vaccinate young horses, so horses less than 5 years of age, against EHV1 and 4 to try to limit the respiratory disease. We're probably not going to prevent it altogether, but it may limit the severity of the signs. With influenza vaccination, however, that can be more effective. There is an intranasal product that's administered twice a year. It's probably the most effective way to try to prevent influenza in horses that are going to different shows or different trail events or things and moving around quite a bit. If it's a 15-year-old horse that stays in the backyard and occasionally goes out on trails with a buddy but doesn't see lots of other horses, it may or may not even need to be vaccinated for influenza. And again, adult horses over the age of 5 years typically are not vaccinated against herpes virus to try to prevent respiratory disease. We primarily vaccinate pregnant mares to try to prevent abortion. The horses that are sick up here that might have a high fever and might have a decrease in appetite, probably the primary treatment we would do initially is to give them either some phenylbutazone or some Banamine to try to bring their temperature down, make them feel a little bit better, and get them eating again. So that's often the only treatment that we often do with these horses. Okay, so that's pretty much it with the viral respiratory diseases of interest, and I want to move on to bacterial respiratory diseases. So again, Streptococcus equi is the one that's probably most commonly recognized, and this causes what's known as strangles. And the reason is that this bacteria, which is not typically in the back of the horse's throat, can get introduced to the horse, and it goes into the lining cells of the upper respiratory tract, and then it goes to lymph nodes that drain that area. And in the lymph nodes, the infection will start to grow and develop into a large abscess. So this sort of cartoon drawing here shows a enlarged lymph node in the throat latch of the horse, and they may also have some nasal discharge with this disease. Sometimes these lymph nodes get quite big, and this is also the throat latch of a horse where we've actually made an incision and we're draining out large amounts of this very thick, creamy yellow pus. That's very typical of strangles in horses. Now, strangles is a streptococcal organism, and I said earlier, we know certainly children can get strep throats, but the Streptococcus equi bacteria is fairly specific for the horse. It does not typically affect humans. So this is really a disease of horses. So it is highly contagious, and we know that because you can see disease outbreaks and lots of horses develop abscesses. This is a horse here in which a couple of areas opened and drained after abscessing, and we're starting to see the healing phase. It can affect all ages of horses, but it causes the most serious disease in foals, because sometimes in foals, if we get large abscesses developing in these lymph nodes and the throat latch, it actually can pinch off the trachea and make them not be able to breathe. So the trachea is narrower and more flaccid in a young foal, or the cartilage is just not quite as strong, so a big abscess can lead to compression of that, where that would be extremely uncommon in adult horses. After they get this disease, they typically recover again, and they develop fairly good immunity. We used to think that they would recover and have lifelong immunity, so this was a disease that was desirable for a foal or a weanling to get, because if they got it, they would be immune for life. We now recognize that horses can be reinfected with strangles, so the immunity after infection probably lasts somewhere from 3 to 5 to 10 years. We don't know exactly, but it's not lifelong immunity. As I've already alluded to, some people feel that this is just sort of a childhood disease, and so the treatment is controversial. We might want to just let it run its course, the abscess come to a head, open and drain them, and let the horses recover. And again, the only treatment that they may need is some bute or some banamine to decrease their fevers and the inflammation there so they continue to eat and drink. Another philosophy for treating this disease is to stop it in its tracks. And this would be more applicable to a show barn, let's say, that has 40 horses and they're actively ready to go to shows every weekend through the spring, summer, and early fall. And so let's say we see the first clinical case of strangles in the beginning of May. Well, if we let this disease run its course through that barn of 40 horses, we may have those horses out of performance for up to about 6 months, because not all horses will get sick initially. It might take a few months for it to go through, but we wouldn't want to ship those horses out of that farm to spread the strangles to other potential facilities. So in that situation, sometimes the philosophy of stopping it in its tracks is when the first horses are noted to be sick, we start taking temperatures of all the other horses and treat them with an antibiotic. Again, it's a streptococcus, so penicillin is the drug of choice. We treat them immediately as the fever develops for about 7 to 14 days, and the goal there is to prevent abscesses from ever developing in the first place and to try to turn an outbreak into a shorter period of time to be withheld from performance. So instead of a 3 to 6 month course of this overall disease going through 40 horses, we might have the barn only closed for 6 to 8 weeks. Now, vaccination is also obviously of interest because we want to try to prevent this kind of disease. There also is an intranasal vaccination called Pinnacle for strep equi or strangles. There also are intramuscular vaccines, and I should have mentioned with flu, there are also intramuscular vaccines as well, but the intranasal vaccines show better protection when horses are challenged with the organism. However, before you would implement a strangles vaccination program for your group of horses, you should have a serious talk with your veterinarian, because we have to be a little more caution here, because this organism vaccination against this organism is at greater risk of leading to some adverse effects of local abscesses where the injections are given to similar clinical signs of the disease. So it's not a vaccine just to be taken lightly. So you want to have a good talk and make the decision on a more informed basis if you would want to vaccinate your horses. The intranasal products are what we call modified live. So a modified live virus for influenza or a modified live bacteria for the strep equi. So we're actually inducing a milder form of the disease that should be self-limiting, and once done, induce good immunity. But sometimes we get more serious disease, and so we have about a 5% chance of a potential serious complication with strangles vaccination, where the chance of a serious complication of the vaccination with influenza or herpes is much, much lower, maybe 1 in 10,000 to 1 in 100,000 horses getting in trouble with that. Okay, so strep equi, how come it's still around? How come we haven't been able to eradicate this disease? Well, it seems like even though most horses don't have it in the back of their throat, there are 2 to 3% of clinically normal-looking horses that have this organism in what we call their guttural pouches. The guttural pouches are the eustachian tube in the back of our throats, but in horses it dilates into an air-filled sac about the size of our fist between the back of the throat and the ear. So these guttural pouches can be a reservoir for the strangles bacteria, and if we go out and survey, we found about 2 to 3% of normal horses have it. So that begs the question, if you go to a horse show and there's 100 to 200 horses there, the likelihood is that strep equi is in 2 to 5 to 6 or 7 horses at that show. Now, they may not be shedding it at their nose, even though it's in their guttural pouch. They may shed it intermittently, but we never know. If the circumstances are right and your horses interact with horses that are shedding, you may come home and 3 or 4 days later find the horse getting a little fever, and then 3 or 4 days after that, the throat swelling, and all of a sudden, before we know it, we have a strangles outbreak. So how do we detect this strangles organism? Again, the best way is a nasal swab. This time we're not going to do tests for viruses. We're going to culture it on media that will look for this bacteria. Now, we typically don't like to put a swab up a horse's nose to culture bacteria because the nose has lots of different bacteria in it. So we're going to get lots of different things. However, if we're asking the question, is strep equi one of those things, then it's a good way to do it because we can read between the garbage and see if strep equi is there. Now, outbreaks with strangles can be quite variable, and that's one of the difficulties in trying to figure out if what you have done in terms of prevention and limiting the disease has been highly affected or not. As with the viruses, it typically causes low morbidity. In other words, what I meant to say here is the outbreaks are variable. We can have some outbreaks of low morbidity. In other words, maybe only 2 or 3 or 4 horses out of a group of 40 might get it. In another scenario, we might have high morbidity where 20 to 25 horses can get it. And that seems to be related to the general immunity of the herd of horses. Because of the variable nature of this, when we go ahead and try to implement a vaccination and prevention program, sometimes we don't know if it was the vaccination that caused low morbidity or just good luck on our parts. Sometimes, despite vaccination, we still get high morbidity, high outbreaks of the disease. As I mentioned, complications can occur with the vaccination, but complications can also occur in about 10% of horses that develop the classic strangles infection. And I'll show a little bit more about that in the next couple of slides. I wish I could say that in my career I would be confident that Streptococcus equi would be eliminated from the horse world, but I don't think it will. It's pretty good at hiding out in the guttural pouches, and our vaccines are only partially effective. So 50 years from now, we're probably still going to have strangles outbreaks like we have today. 2 complications that can occur with this are a condition known as bastard strangles. Bastard strangles just means development of an abscess in more distant locations. And we can see here these cartoon pictures of the strangles organism. So here's the strangles lymph node that is draining right here, but these bacteria, they can actually get in the bloodstream and travel throughout the bloodstream intermittently as the horse is ill. They can find places in the lungs, commonly the intestine, or some of the lymph nodes in the intestine to form abscesses in distant locations. How do we know this is going on? Well, a horse in the recovery period after strangles, after a month or 2, we just look and say, this horse is losing a little bit of weight. And we might detect a bastard strangles abscess in the abdomen by doing a rectal palpation of the horse. This more dramatic photo over here on the right actually shows a strangles abscess in the brain. This is the brain of a horse. And obviously this horse didn't make it. That's why we have its brain. About 10 years ago here at MSU, we actually had a horse that had a brain abscess and was showing some pretty bizarre neurologic deficits and collapsing. And we were able to take it to surgery and drain this abscess. And this horse lives up near Traverse City. And about 10 years now, it's gone by now, and this horse is actually completely normal, is being ridden and being enjoyed. So that was sort of a success that we don't commonly see. The other type of complication that we get with strangles is what's called purpura hemorrhagica. Purpura hemorrhagica is actually where the blood vessels, a lot of small blood vessels, get inflamed. And this is a vasculitis syndrome. And vasculitis syndrome is associated with swelling, usually along the bottom of the abdomen and in the legs. This is the early stages here, and we can see some nodules developing here over this horse's shoulder, over the abdomen, and this can progress to leg swelling and a large amount of swelling along the lower midline. Here's a gray horse over here, and can't see it all that well, but his forelimbs were quite swollen, his hind limbs swollen, and he had been sick for about 2 weeks with this purpura when this picture was taken. So this is a pretty significant complication that can happen with this. The good news, at least for this gray horse, is that he fully recovered and went back into exercise, and so again fully recovered from that disease. But it certainly can be a complication that can lead to more prolonged treatment. Okay, that's it for strangles. We're going to move into a bacterial respiratory disease of foals, this Rhodococcus equi, next. Rhodococcus equi is a serious problem on large farms where they have, 50 to hundreds of foals. So it tends to be a farm problem. And what happens is the Rhodococcus organism can sort of get mixed in the soil on the farm and stay there to persistently infect the next crop of foals and weanlings. So big risk factors for this disease becoming serious are overcrowding. Dust and dirt in paddocks, and this can even occur in nice grass pastures, where if you think about how groups of weanlings might hang out in the corner of a pasture and stomp their feet and sort of wear down the grass and have a little dirt spot, in certain areas despite having a nice grass paddock. So that dust and dirt can be a source of it. In addition, the foals and weanlings themselves can be a source of it. What their air they're breathing out, if we have an infected foal, that can have lots and lots of the Rhodococcus equi that they can spread by their nasal secretions and aerosols to the foals around them. Another big risk factor for significant disease appears to be high environmental temperature. So fortunately up here in the upper Midwest in Michigan, we don't see too many big farm problems with the Rhodococcus equi, though we do see an occasional foal, and we lose 1 or 2 foals a year here with severe disease. What's interesting about this disease is the early stages of the disease are often not recognized. The foal might just have a fever, can be quite high, up to 105, and a little bit of a decreased appetite, but if it's in a group of weanlings out in a paddock, this might not be picked up the first few days because they're being group housed and they feed as a group. What's not here is nasal discharge or much coughing. In strangles, the nasal discharge becomes quite obvious, and so we can tend to see that disease fairly easily, whereas here we might not see other signs of respiratory disease. If we examine these foals a little bit more closely with our stethoscope, we'll tend to actually hear quiet or decreased lung sounds due to large abscesses forming in the lung. And probably one of the best ways to sort of evaluate foals for this is to stand back and look at them as a group and see if any of them have an elevated respiratory rate or an increased effort. Those would be foals that we would have to look at more closely. So as I said, this organism that can get into the respiratory tract, it's not normally in their respiratory tract, it can cause large abscesses, as we can see on this x-ray. So in this x-ray, the foal's head is over here, the tail is over here, here's the foal's spine up along here, this is the foal's heart down here, and this whole area should be black with airflow. But what we see are these different round objects in here. These are large abscesses, and if this foal does not recover from this disease and goes to the autopsy floor, we see these large round abscesses. Sometimes they come to the surface of the lungs, and we open these up and they're filled with just a creamy pus. And you can see here how this has affected about 70% of this foal's lung, and it's a very serious disease. Well, how would we diagnose this disease? Well, in suspect foals that might have fever, increased respiratory rate, and the other thing about this disease is because it might take a week or 2 even before it to be recognized, the foals may have not been eating so well. We'll start to see the foals looking like they're a little ill-thrifty. They're not really got the weight we would like on them. So that's a big sort of red flag if the foals don't look that good. And to confirm it, we would need to take some radiographs or do ultrasound to look again for these abscesses, and then to find out that this Rhodococcus equi is the organism, we collect a sample of the secretions in the trachea by doing what we call a transtracheal aspirate, culture the organism, and get our diagnosis of Rhodococcus equi. So the treatment of this disease, as you can imagine, because of these abscesses, is quite prolonged. The drug of choice are what's called macrolide antibiotics. In Michigan, we use mostly azithromycin. Another drug is clarithromycin, but the treatment course is prolonged. We may have to treat for 4 to 12 weeks. One of the best ways to figure out how we're doing is 4 to 6 to 8 weeks later, take a set of follow-up lung x-rays or radiographs and look for the improvement. Now this disease is more serious than is strangles or the viral respiratory disease, so the prognosis is guarded for both life and performance, and in an outbreak of this Rhodococcus equi, maybe up to 10% of foals might actually succumb to this disease or die. So really we want to try to prevent this in the first place and never get to the point of treating it. How do we prevent it? We really watch our foals closely for, again, increased respiratory rate, monitor them for their temperatures or fevers. And if you have limited manpower and you can only take their temperatures once a day, the best time to take the temperature and look for a fever is in the later afternoon when foals are coming back in. And if temperature in a foal over 102.5, or especially over 103, warrants further evaluation. Some of the bigger farms, they're routinely doing ultrasonography of the chest as a screening tool, and they're finding actually that a lot of the foals that look okay do have some small abscesses in their chest. Many of these foals in the past probably cleared this disease on their own, so but when those are found, typically antibiotic treatment is recommended. Management-wise, if we've got too many horses and overcrowding, decreasing foal numbers might be one of the smartest ways to try to prevent or limit this disease. In those paddocks where they're dusty or the corners of the pasture, we might want to mount a sprinkler system on there, so on a timer, so 4 or 6 times a day we can have just 10 minutes of sprinkling to keep the dust down in the dustier areas of the paddock. Certainly in the summertime, the horses don't mind standing in the sprinkler and getting themselves cooled off as well. Over the years, a way to try to prevent this disease has also been give plasma to foals. Typically they get it at about 2 or 3 days of age, and then another plasma transfusion at about 2 weeks of age. So an intravenous catheter is placed in the jugular vein, and a liter or about a quart of frozen plasma is thawed and given to the foals. And this plasma is hyperimmune, which means it has high levels of antibodies against the Rhodococcus to try to limit the spread of the disease. Even though a number of studies have been done over the years, it still remains somewhat controversial whether or not this hyperimmune plasma is really all that beneficial. And it is quite an expense to undertake, so it needs to be talked about with all the people involved in the farm. Okay, so that's it with Rhodococcus equi. Next, I just wanted to talk a little bit about pneumonia in adults. Sorry, I think my microphone went off for a second. So pneumonia in adult horses, spontaneous pneumonia, is quite rare. Okay, unless they have the bad accident of inhaling a little bit of a twig or something that gets lodged in one of their airways, that could lead to damage. It could lead to pneumonia. If they have bad choke, they could end up with aspiration of food material from the choke, and then also even an esophageal rupture in severe cases. And sometimes when they have what looks like pneumonia, horses may actually have lung cancer. So the bottom line is, horses standing out in the field not doing too much should not really develop pneumonia. Pneumonia becomes a much bigger problem in horses that are shipped, especially long distance, so a transport more than about 750 miles. And really what this is, it's another form of aspiration pneumonia. And the reason for that is oftentimes when horses are shipped, they're placed in cross ties and they can't lower their head to normally clear out the respiratory secretions that accumulate. As those secretions accumulate, normal bacteria from the upper airway in the mouth cavity can actually go down into the lungs and cause some damage. Other things that can make this damage even more are, let's say, strenuous exercise. So let's say it's a horse that goes on an endurance ride for 50 or 100 miles, recovers for, maybe overnight, but still pretty worn out the following morning, then has to go 750 miles home. That's adding a couple of insults that can increase the risk factor. I've already mentioned that traveling with the head tied up, and then often people put hay nets right in front of the horses or hay bags, and if you're going down the highway at 60 or 70 miles an hour, a lot of dust goes right up in the nose into the lungs. So we don't recommend having hay in front of the horses. Rather, take some stops along the way, and at that time go ahead and offer them a chance to eat and drink a little bit. The cartoon over here illustrates a cross section of the chest. So these are the lungs here. So we have 2 lungs. This is the backbone. This is the trachea, where the air comes into the lungs. And healthy lungs should be nice and pink. When we get pneumonia and aspiration, the bottom half of the lung gets inflamed. And sometimes that actually leads to inflammation to the surface of the lungs and a little bit of fluid leaking out and accumulating in the space outside the lung called the pleural space. That can actually get more serious, where bacteria from the lung can leak out and cause an infection of this fluid. And this is what we call pneumonia with the pleural involvement, or pleuropneumonia. And this can be quite serious. So our friends over across the pond in the United Kingdom always say that, boy, we must be doing something wrong here in the States because they just don't see the shipping fever in the United Kingdom. So we have to think, why is shipping fever less common in the United Kingdom compared to over here in the U.S.? Well, the simple answer is simply that if they drive more than 200 or 300 miles, they're going to end up in the ocean. So they don't really have long distance transport. They would have to go in a big circle to haul horses more than about 12 to 18 hours. So they just don't have the same problem because they don't ship horses as far. So pneumonia in adult horses, the shipping fever, typically is manifested by a fever, and that fever shows up shortly after arriving home. Decreased appetite, sounds familiar to these other diseases, and sometimes pain after transport because the infection in the lungs and outside the lungs in the pleural space can be quite painful. So we may have horses that look like they're colicky. They may even look like they're foundering. But if they've got a fever, we should assume they have this pneumonia and to improve and otherwise. Ultrasonography of the lungs is also useful to show where we have some consolidation or filling of the lungs with fluid, and also some fluid accumulation outside the lungs in the pleural space. We want to do a transtracheal wash here, like we talked a little bit earlier in the Rhodococcus equi, to try and diagnose which bacteria. But what we typically find is it's a mixed bag of bacteria, and again, these are bacteria that come from the upper airway in the oral cavity anyway. They're not that they caught a bad bacteria from another horse in the trailer. It's their own bacteria that get down in their lungs. We want to aggressively treat suspect horses. So after long distance transport, if they're showing these signs, we want to get them on broad spectrum antibiotics. So this is more than just penicillin. So usually penicillin and gentamicin, or a drug called Naxel, we would use, and we give them some anti-inflammatory drugs to make them feel better. So again, the bute and the banamine. We don't want to give them a cortisone shot, because if we do that, we further suppress their immune system, and this can make the disease even worse. So we want to treat them aggressively for 4 to 7 days, sort of see how they do. And in case, it's probably here better to be a little bit safe and maybe be overly aggressive in some horses than to get into the situation where we're going to get more serious disease. One of the indicators that we have more serious disease going on is that the horses may relapse after 4 to 10 days. So initially they respond favorably, their fever gets under control, they start to eat, but then maybe day 4 or 5 into it they get another fever, their appetite backs off. That's a serious red flag warning sign that your veterinarian needs to take another look at the horse after the initial look that they had already done. So pneumonia, again, here's the cartoon we looked at before, but it can cause some pretty serious disease. So here we can actually see in the bottom of the lung a reddened area here, and this is a lung that's full of fluid, much like in our cartoon. If we look at this on ultrasound, here's the body wall over here. So this would be looking into the right lung. This is the surface of the lung, and it should have this bright line showing aeration. And while we can see, we trace along here, we see the air in the lung is deeper. So this whole area of lung here is actually consolidated or filled with fluid. Now over the next couple of weeks, this is either going to heal, or it's going to leak bacteria outside of the lung in the pleural space, or even this lung could die off and become an abscess. Well, as it becomes a little bit more serious and we see the reaction outside the lung cavity, this is an autopsy specimen here. The horse is down laying on its side. This is the lung here. This is the rib cage on top that's been pulled up as we're looking in here. And we can see all of these adhesions from the surface of the lung to the rib wall. And that's due to the inflammation that occurs outside the lung. On ultrasound, we can see the bottom of the lung here, and we see all of this honeycomb pattern of fluid and these strands of the reaction. And that obviously is a serious disease. There's bacteria in here, and this takes several months of treatment to get that cleared up. So we have two types of this pneumonia case. Typically an uncomplicated case, it may develop some fluid outside the lung. That fluid tends to not have bacteria and it becomes sterile. This case may need antibiotics for 2 to 4 weeks, and we may at once or twice or not at all have to put a tube in the chest and drain the fluid out. These horses are going to be out of work for 1 to 3 months, and they typically have a favorable prognosis, although treatment of this disease is not inexpensive. Probably going to have several $1,000s, $2,000 to $3,000 to treat this horse over a period of a month. This disease is often preventable if we're more careful about our transportation and if we recognize it early afterwards. So we recognize the fever, get them on antibiotics appropriately in the first couple of days. Where we get into trouble are horses in which we have problems with transportation or in which they get sick and stay sick for 5 to 7 days before it's really recognized and they don't get on appropriate antibiotics. We just unfortunately had a case in which we had a horse that was shipped back from Denver here to the Michigan area after a show. During the trailer ride, there was a breakdown of one of the vehicles, and so a ride that they were going to have two trips of about 12 hours and take a break in the middle, which is what we recommend, a period of time, get the horses out, unloaded, they get their heads down and clear out these secretions. Well, the horses ended up being on the trailer for about 18 to 20 hours, and one of the horses developed very serious shipping fever, and we were not able to save that horse. Now, this can become more complicated, as I said earlier. The infected lungs can lead to bacteria leaking out into the fluid and what we call an infected effusion. These horses are going to be sick a lot longer and are going to require antibiotics for 2 to maybe up to 6 months. In the lung cavity, that area that was consolidated may actually die off and become a large abscess, and all of this abscess sort of pus will not be effectively drained by a chest tube. And in that situation, we have to sometimes actually open up, make an incision between the ribs here. Like we see here, there's a chest tube at the bottom and a big incision, and we actually drain out a lot of this pus material over a period of the next couple of months. These horses can lose a lot of weight, as we can see on this thoroughbred mare here, and this mare was actually hospitalized for 13 months, eventually recovered from the disease and went on and had a number of foals. But it's a very serious disease, so we want to try to avoid this if at all possible. Again, early diagnosis and appropriate shipment, because this is quite expensive to treat these horses. Okay, well that's the infectious airway diseases I wanted to get through, and I'm sort of going a little slower than I probably should, so I do have a little bit more on non-infectious airway diseases that I can try to get through, and then we'll have a little bit of time for some questions. Unless, Amanda, you want me to stop here and not go any further and go with questions now. What do you think there? You want me to continue?
Yeah, I think go ahead and finish up and answer questions at the end.
Okay, sounds great. Well, non-infectious airway diseases, again, we started at the beginning. We have airflow obstruction during exercise are probably the more clinically important. So we can have narrowing of the upper airway. This is an endoscopic picture in the back of the throat of a classic roarer. And the roarer is where we have this cartilage here called the arytenoid cartilage that's paralyzed, and the vocal cord down here is just hanging up and down a little bit more straight. So this normally should be pulled out over here to open the airway up, and what happens is when the horse tries to breathe in more quickly, this one actually can collapse over and pull over here and make a very narrow airway, and the air going across this vocal cord makes a noise called roaring. We treat this by a surgery to actually pull this up permanently out of the way. So upper airway problems can be roaring and others. Typically need surgery to fix. We also can have lower airway disease, as I mentioned earlier, and this is where we can get accumulation of mucus. We can see puddles of mucus in the windpipe or trachea of this, and actually as air was flowing back and forth, there was a wave that formed in this mucus, and that causes a lower airway obstruction and coughing and sometimes difficulty breathing. This is an endoscopic image of the trachea of a racehorse after racing exercise, where we can actually see blood pooling in the trachea. So this is our exercise-induced pulmonary hemorrhage. So upper airway obstruction, one of the hallmarks of this is it's usually accompanied by an airway noise, whereas the bleeding or the mucus in the lower area of the trachea typically we don't hear any noise made by the horse. The roaring, or the idiopathic laryngeal hemiplegia, as it's called, is one of the more common ones. And again, we can see here's a normal airway. This is the opening for the air to go into the trachea. These are the two cartilages called the arytenoid cartilages at the top, and this triangle is called the epiglottis. So this is an open airway. Now when this horse needs to eat food, this epiglottis will lift up and cover this airway, opening the trachea, and the food actually goes down the esophagus up here. We're a little bit closer up on this portion of the airway called the larynx here, and again this is a roar, and we can see again the collapse of this one, and this limits airflow. Well, here's another problem that we'll sometimes see, and if we look at this endoscopic image, something's missing. Our epiglottis is missing, and this is what's known as dorsal displacement of the soft palate. So the extension of the hard palate, which we can feel on the roof of our mouth, to the soft palate is what forms the floor of the normal pharynx, the back of the throat. Sometimes we have the soft palate flip up over here, and this causes a noise, most commonly in racehorses, sort of a snoring noise as they exhale. Again, these problems have to be diagnosed requiring a resting or a treadmill endoscopy, or more recently Dr. Dirksen and some colleagues here at Michigan State have developed a microphone system where we can send it home with the horse and actually record the airway noise and look at it on a computer, because we find the roaring and the palate have characteristic noises that can show up actually on a spectrogram of airway noises. So a little bit like voice recognition systems, we can use that to try to figure out which of these problems they have. Treatment generally requires surgery for this disorder. Here's another one over here where the epiglottis is still present, but we see sort of an hourglass closure of the airway, and that's where little ligaments that go from the arytenoid cartilages, the epiglottis, what we call airy epiglottic folds, are a little bit redundant or too much tissue, and as the horse breathes in deeply, he just sucks them towards each other and really narrows the airways. So again, surgery is typically required for those problems. In the lower airway, again, we can have obstruction due to accumulation of mucus in the lower airway. We talked earlier about this non-specific airway irritation is largely an environmental disease from breathing in hay and barn dust, not typically that they have to be allergic. During exercise, there's also increased airflow, and for any of you that are runners in the wintertime, you know if you go out and run in the cold, you're going to come back in and you're going to cough for a few minutes, and that's just the cold air that irritates the airway. So a number of environmental factors can lead to this, and one of the defense mechanisms of the lower airways is to increase secretion of mucus, what we call inflammatory airway disease, and they get increased mucus leading to coughing during exercise, and up to about 1/3 of racehorses are affected with some degree of this. Now, these horses are otherwise healthy as a horse. They have a good appetite, no fevers, but they may have a slight decrease in performance, and they might have a mild cough, especially at the beginning of exercise. And we diagnose this with endoscopy, looking for mucus accumulation in the trachea like we looked earlier. Here again we see varying severities of it, and we actually have a scoring system for clean is 0 right here, out to about a mucus accumulation score of 4. And actually some work by researchers here at MSU has the conclusion that mucus matters. In other words, the more mucus there is, the more likely it's going to impair performance when we're talking about racing horses. So in racehorses, if we get a mucus score of 2 or more, they actually do finish a little bit further behind in the race. So this disease does cause poor performance. Now what about our 3-day horses or other types of show horses that are not going at completely maximal effort like the racehorses? The mucus probably is not a limiting factor to those horses, but may cause a cough at the start of exercise. Now the other one again is accumulation of blood in the airway, or exercise-induced pulmonary hemorrhage. I showed this picture earlier of a little bit of blood at the nostril. This is called epistaxis, blood coming out the nose. This is not a nosebleed, though. This is actually blood that comes up the windpipe, the trachea, from the lungs. So if we look at racehorses, about 2 to 3% of them in the 20 minutes to an hour after exercise will have a little trickle of a blood. If we do endoscopic exams and look in the trachea, 25 to 50% of them will have some blood in their trachea. Most of the blood that comes up to the back of the throat, however, is swallowed and does not come out the nose. If we look at an even more sensitive technique and we do a lung washing, we put a tube down into the lungs, put some fluid in there, aspirate it back out, and look at the cells we recover in the microscope, we find evidence of what we call hemosiderin, which is a breakdown iron product of red blood cells in housekeeping cells called macrophages in the lung lining cells, or the lining here. And if we do lung washings within the first week after racing type exercise, we find essentially 100% of horses have evidence that they have bled where their trachea might have been clear and they wouldn't have had this. So bleeding appears to be a consequence of high intensity exercise. And why do horses bleed? Well, there's a weak link in the pulmonary circulation, or the lung circulation, called the capillary, a very tiny vessel. We have capillaries all throughout our body, and that's where the nutrient exchange and the gas exchange occurs. However, in the lungs, the capillaries are a weak link between a very high driving pressure of blood coming out of the heart through the lungs and, that should be a stiff left ventricle, so blood going back into the lungs that may limit cardiac filling a little bit during strenuous exercise. So horses, unlike people, have very high blood pressures in their lungs, both on the system going into the lung as well as the system draining the lung, so it leads to transfer of the high pressure to the pulmonary capillaries, and they actually rupture or fail under this stress. So the big question for a number of years at the racetrack was, is bleeding, or is EIPH, a cause of poor performance? So a group that was headed up at the Ohio State University looked at this a few years back, and they used a standardized scoring system to look at the bleeding. And so here's some different degrees of bleeding after exercise. This would be what we call a grade A or a grade 1, just a little splotch of blood. Here's a little trickle, so a grade 2 or B. Grade 3 is a number of these sort of little rivulets around the trachea, and a grade 4 or grade D is at least half of the trachea or more is covered with blood. So we may have to make this diagnosis by scoping horses 20 to 40 minutes after exercise. So a group at the Ohio State University, headed up by Dr. Ken Hinchcliffe, published in 2005 this figure. And they did this work down in Australia, and they looked at a large number of horses, over 700 horses. And what we can see along the bottom axis here is this EIPH scale or grade that I just showed you on the last picture, 4 being the most severe and 0 being no blood. And this is the distance behind the winner in meters. So how far back they were. Now, 4 meters behind the winner is not that far. It's barely 2 horse lengths, but it certainly would take them out of the money, perhaps. And what you can see from the data here is that as we got a progressive increase in EIPH score, horses were further back. So this says EIPH does affect performance. Now, many of you may have heard that there's a drug called furosemide or Lasix. It's a diuretic that's used to treat bleeders, and that's been used for about 40 to 50 years. And it's actually between a $30 and $40 million industry in the United States to administer Lasix to horses before racing exercise. It's administered 4 hours before, and furosemide is a diuretic medication, and what it does is it decreases some of the body fluid volume and thereby limits the increase in pressure in the pulmonary circulation. And for years it was speculated that may help prevent bleeding, but nobody really knew until the same group of researchers just in this last year in 2009 developed a very exquisite study. They actually had to do this in South Africa. It took them about 4 to 5 years to get the funding, which required about $500,000 to do this one study. That's a huge budget for an equine study. And they looked at 152 thoroughbred racehorses that raced twice a couple of weeks apart. In one race, they received the furosemide. In the other race, they received placebo, which was just a saline injection. And what they found is that horses that had an EIPH score greater than 1, or that horses that were not treated or just given the placebo were 3 to 4 times more likely to have an EIPH score greater than 1, and they were 7 times more likely to have an EIPH score greater than 2. So in other words, furosemide significantly reduced the bleeding during these thoroughbred races. So furosemide does help prevent bleeding. The unanswered question that persists is, does furosemide enhance performance by decreasing bleeding? And that study has not yet been performed and the question not yet been answered. Okay. Lastly, I just want to mention a couple comments on the last non-infectious airway disease, which is what we call heaves. So this one causes airflow obstruction at rest. So we see horses that have difficulty breathing just at rest. We call this, again, recurrent airway obstruction, better known as heaves. Now, this disease is characterized by excessive inflammation of the lower airways, and there is some allergy associated with this. And the response of the airways to excessive inflammation is mucus secretion, a lot like the inflammatory airway disease. This typically leads to coughing. Now, with the activation of smooth muscle, these horses can also get what we see in people having an asthmatic attack, or bronchoconstriction. So bronchoconstriction leads to the increased respiratory effort. This little cartoon here is of an airway, and it shows what happens to the resistance to airflow. This is a normal airway diameter right here of 1, and we have good airflow in and out. If we reduce that airway by a half, so the radius is now 1/2 what it is here, the resistance to airflow increases 16 times. So it's much harder with an airway that's constricted to get airflow in and out, and that's why they breathe harder at rest. So the result is we may see over time horses develop hypertrophy or excessive thickening of their abdominal muscles. They are working to push out the air. So in a way they're doing sit-ups and they're getting nice abdominal muscles, and we see it as a heave line. If we look at their nose, we may see a flaring of their nostril. On endoscopy, again, we're going to see mucus accumulate in the airways. Excuse me. So finally, this is a disease where we actually do have some allergy components, as well as the non-specific airway inflammation of the dust that's in the barn. But we find that some of these horses are truly allergic to hay dust, so it is a little bit similar to asthma. We've also found that there are genetic predispositions. There are some lines of horses that are more likely to be heavy, and so hopefully in the not too distant future there may actually be DNA tests to predict the likelihood of a horse becoming heavy. Now, in addition to the allergy, just being in the barn, that barn dust exacerbates the inflammation. And here, if you can see on this horse eating hay, when they take a bite of hay, there's a big cloud of dust that comes with it. So that's one of the reasons our recommendations are sometimes to wet down the hay in horses with heaves. So lastly, our management of heaves really involves management of the condition more than treatment. We want to really improve the environmental conditions. They should be outside 24 hours a day, 7 days a week, 365 days a year. But in the wintertime, they should not be burying their noses in big round bales of hay because they're still in a lot of dust, as I showed in the very beginning. The ideal diet is pasture, soaked hay or hay cubes to, again, decrease the dust, or some of them a complete pelleted feed if they can't be maintained on just soaked hay. We sometimes have to use bronchodilators when they get sudden bronchoconstriction and have a little bit of a heaves crisis. The most common one that's available is called Ventapulmin, or the drug is clenbuterol. Sometimes we also have to put them on corticosteroids to decrease the inflammation in the airways. And steroids are the mainstay of treatment on a drug basis if we don't have success with improving the environment. However, we found over the years that if we really work on the environment, most horses can be managed just by improving the environment, and we try not to have to use corticosteroids on too many of horses. Horses that are at risk might go to a show and they have a bad environment there. Some of those horses we might have to use some corticosteroids on. We have also done allergy testing by doing intradermal skin testing in some horses and have used allergy shots to desensitize them, and that helps them. It doesn't completely cure them, but it can help decrease the clinical signs. And lastly, I'll just finish up with many of you know that MSU received some funding back in 1994 called the Animal Initiative. And we've used those fundings for a number of research studies over the years. And to just show a couple here that were funded by the Animal Initiative. And this was one on our own MSU horse barn here at campus. And this just showed that stabling is associated with airway inflammation in young Arabian horses. So 2-year-old horses were brought into the stable, and we saw that they developed more mucus in their airways and more cells called neutrophils. So here, the conclusion was that stabling is associated with inflammation of both the upper and lower airway of young horses. Another larger study was done out in the field, where 266 horses were studied by endoscopy and collection of some secretions from the airways at 21 stables around Michigan. And so this was to look at the prevalence and risk factors for airway inflammation in Michigan horses. And they found that horses eating hay, especially from round bales, had the most neutrophils indicative of inflammation, whereas horses fed from pasture had the fewest. Being female and being housed indoors in winters were additional risk factors. We don't really have a good explanation for why females might have been in that study, but being indoors was a risk factor. Being outdoors in winter was actually protective, again, as long as they were not fed from round bales. And
That's all, folks.
I'd be happy to answer a couple of questions if you have them. Does anybody want to type in a question, or?
Questions for you over here on the left-hand side in the chat box. The first one
Okay.
is, are the mares tested first, or do you try for coverage of all dams at these times in their pregnancy? That was from earlier in the presentation.
So that would, the question there would be related, I think, to the equine herpes virus 1. We do not test the mares. Again, likelihood is that 60% of the mares already have the virus, so we are trying to vaccinate them to increase the level of antibody to try to limit the risk of abortion during the pregnancy. And I think next one here. Someone asked, 2 horses that are BLM Mustangs who arrived with shipping fever. Required 2 courses of antibiotics, and the mare miscarried. And that's a stressful disease, and they certainly would be at risk of losing the foal. Finally, we are getting better. Are there any concerns for long-term effects? It's amazing. We used to think that the lungs would become quite scarred from this disease, but more and more work shows that the lung actually remodels over time. So even though there could be some severe pneumonia, 5 or 8 years later, the lungs can be completely normal. So the goal is to try to minimize the seriousness of the disease, but they can have long-term recovery. We've had them go back and race and do all type of exercise after getting the shipping fever. And the thing I would say about shipping fever is if you're going to ship horses long distance, it's ideal to give them a break every day. So if they ship 12 to 15 hours, if you can find a facility to house the horses overnight, ideally a paddock setting where they can get out and walk around and get their nose down to the ground, drain out the secretions, and then load them back up for 12 more hours the next day. Breaking up the trip is one of the best ways to try to prevent that from becoming okay. My vet told me my 24-year-old mare has COPD, which is another term we use for heaves, sort of an older term. It is the same as heaves. COPD in people is a slightly different disease, so we're going away from using that term, but it's still used for heaves. And let's see, the rest of the question was... She recommended that you use an antihistamine called hydroxyzine. This drug will decrease some of the inflammation as well. It is safe to continue to give that drug on a daily basis long term, but I would encourage you to try to really work on environmental things, so going to wetting the hay, and I think if you do that, and you do that consistently, or get the horse out on pasture even more ideally, you can probably get away from needing the hydroxyzine. Next question, is there a relationship between a guttural pouch infection and a roar? Not specifically. The roar is caused by degeneration of the nerves. We don't know why that occurs, but degeneration of nerves that innervate that muscle that pulls that arytenoid cartilage open. It tends to occur in long-necked horses, and by sort of a mistake of embryological development, the nerve that controls the airway actually goes all the way down the neck, around one of the vessels of the heart, and comes all the way back up to the larynx. So long-necked horses, thoroughbreds, big male thoroughbreds, and also draft horses, about 60% of them have a degree of this as well. Now, we do think that there may be a relationship between guttural pouch infection and inflammation and the other condition I called dorsal displacement of the soft palate. We tend to see that in young horses, and we treat that now medically for several months before we would do surgery on a horse with dorsal displacement of soft palate. So there is a relationship between guttural pouch infection and possible displacement of the soft palate. Now, sometimes with strangles, we get a serious guttural pouch infection. There are nerves that course through that guttural pouch that are right underneath the membrane. So sometimes with a serious strangles infection in the guttural pouch, one of the complications we will see is also development of roaring, as well as problems in swallowing, where some of the food goes down into the windpipe. So in that situation, a guttural pouch infection that's very serious can lead to roaring. Okay, next would be, I have a 7-month-old. What vaccinations do I recommend besides the standard recommendations for respiratory infections? Well, probably the young horse could get its inoculations against equine herpes virus 1 and 4, as well against equine influenza. I do recommend the intranasal influenza twice a year. If the herpes virus is a little bit more controversial. If this 7-month-old is staying home and not doing anything, it's probably going to end up getting the herpes virus 1 and herpes virus 4 at some point anyway, and it may not even be all that serious. So it's again, I would talk with your veterinarian, but we'll get different opinions about how important it is actually to vaccinate to try to prevent the respiratory disease. Much more important to try to prevent the abortion. And if you've had a horse suffer a severe choke but no onset pneumonia, should it be scoped to see if there's any scar tissue or residual effect? Not generally. If it gets over this choke within the first day or so, generally you're going to be pretty lucky. The horse probably did aspirate some, but again, there's good defense mechanisms in the lung, the cough, and the clearance of the secretions as the horse puts their head down. So you may have dodged a bullet there, and we're lucky that the horse did not get some pneumonia. My typical recommendation is if a horse has been choked longer than 12 hours, we would use some prophylactic antibiotics to try to minimize the risk of pneumonia from the aspiration. If it's only choked for a half an hour and it's relieved very quickly, those horses typically are going to do okay with their pulmonary defense mechanisms alone, and they don't really need antibiotic treatment. So again, no probably need to have that horse scoped, because you probably won't see anything there. And if I see appropriately, Amanda, that looks like that might have been the last question.
Oh, looks like one more.
Oh, okay. Another one here comes in. Is there another drug other than Lasix that can be used for exercise-induced pulmonary hemorrhage? There are a lot of drugs that have been tried. Some are in the estrogen family, a hormone, because we tend to think that blood clots better when the estrogen levels are high. But the only one that's really been effectively shown to decrease the severity of EIPH is the Lasix. Now, you may recognize that not all parts of the world allow Lasix to be used. And so in that situation, another thing that has been shown to help limit the bleeding is actually the nasal flare strips that you'll see on a lot of athletes, like football players and other players. They've developed a nasal flare strip that actually goes over the bridge of a horse's nose, and that actually helps open up the nostrils and can limit some of the air resistance to airflow, and that's been shown to do that. And shortly after the nasal flare came out, about 8 years ago, about 70 or 80% of horses in the Breeders' Cup were wearing those nasal flares. So it's a nice non-pharmacological or non-medical way to try to limit it, but it hasn't been shown to be as effective, again, as the Lasix or the furosemide. And let's see here. Where are we? The next question here was, I had a Spanish horse that was shipped from Spain to Miami. So he had the luxury of probably flying over, so that's not as stressful as the road transport, and he arrived with what looked like a cold. So that would be a warning sign, some nasal mucus. We would recommend there to treat aggressively for possible shipping fever. So you asked a vet to scope the horse, and he recommended antibiotics. And so the first treatment did nothing, and he recommended a second treatment and refused to scope him. 2 weeks later, when I had my vet look at him and scoped him, he had a really bad guttural pouch infection, which my vet said cannot be treated with antibiotics. By this time, the airway on the one side had collapsed and there was a roar. And it may have actually been that the horse was a roarer before it was ever shipped. And if it was not scoped, over in Spain, it may have been that it was an unidentified roar, and the fact that he was a roarer might have increased the risk of some aspiration during the transport, making the cold a bit worse. The antibiotics would have been needed to treatment, so the lack of scoping it initially, I don't think really would have made a big difference in the outcome. I don't think there you can say that he had that caused the roaring, the infection caused the roaring, because we don't know if it was pre-existing or not. Except you say that looks like it may have been there. Let's see where I'm at. Sorry. Next question is, I have a horse that was coughing due to be on a dusty round, maybe bale. When he started coughing, I moved the round out and started some unsoaked hay. The vet put him on clenbuterol, the bronchodilator, as he was well for a while. Since then, I've heard a few coughs a couple weeks ago. Does not cough with work. Good pulse and recoveries. Out 24/7, which is great. I can hear him breathe. It's not wheezy, or at least it doesn't sound like that. What it may be is that there's probably more mucus in the airway. And the best way to actually hear what it sounds like would actually to be get just a stethoscope, and there's some that are pretty inexpensive you can buy at the drugstore, and see if you hear a gurgle over his trachea. You might even just put his ear right down here, put your head in his ear right over the trachea, and hear if you hear a gurgle, and that would be some extra mucus in there. Now, a wheeze is a more musical sound, which we hear over the lungs. We would need a stethoscope to hear that. I'm not sure if I can recommend right now a website with those sounds where you could go hear them. I don't know one off the top of my head. And does that look like it's about it? There. Well, I can't say for sure on your roar whether or not when that happened, but if it was a severe guttural pouch infection associated with the transport, as we said earlier, sometimes we see that with strangles, and if there is a severe guttural pouch infection that persisted for a while, it can damage the nerves and it can contribute to roaring, but that's not the typical thing that we would see. So, any other questions?
Well, if there aren't any more questions, I would just like to briefly wrap up and say thank you so much to Dr. Schott for his presentation this evening, and to all of you for participating. Later this week, you will receive an invitation to participate in an online survey about tonight's webcast, and if you could take a few minutes to give us your feedback, we would appreciate it. And next month, My Horse University and HorseQuest will continue this horse health series with 2 free webcasts on lameness, and a free webcast in April will feature equine emergency first aid. And just to let you know, My Horse University is now on Facebook, so become our fan to have access to exclusive deals and get the most up-to-date information on our events, courses, and more. And just a reminder that this webcast was recorded and will be uploaded to our website by the end of the week. And you can send us your comments and suggestions to info@myhorseuniversity.com. And thanks again, and have a great evening.
Thank you for your attention, everyone.